All right. Welcome everyone to today's live discussion, the next phase, Delta variant and communities of color. My name is Noah Federici. I will be hosting today's discussion. I'm the Vice President of Revenue Growth and Strategy at Quality Interactions. And I would like to begin by introducing our guest, returning guest today, Dr. Betancourt. Dr. Joseph Betancourt is the Senior Vice President of Equity and Community Health at Mass General Hospital. He's also one of the co-founders of Quality Interactions. Dr. Betancourt has led the Mass General Brigham COVID Equity and Community Health Response Team since March of 2020, and that includes all vaccination efforts. Thank you, Dr. Betancourt. It's great to see you today, and if it's all right with you, could we jump right in and begin, starting with what is your take on where we are in the COVID pandemic today?
Great, thank you, Noah. And it's I'd like to say it's great to see everyone. Number one, I can't see you, and number two, I'm not too excited to be here again talking some more about the pandemic. Certainly, I think we had hoped that we were all done, and but I'm thankful for the opportunity to humbly share, some perspectives about where we are today with this community, which quite frankly has been, wonderful and with us throughout the year, tuning in for these conversations, hopefully asking some questions. So, it's a lot of mixed emotions that I think we're all back here together again. But I'd say a couple of basic things to kick us off. We are back. Why are we back? Because we see a resurgence in the pandemic. We'll get to all the whys in a bit, but certainly I think we understand that, and we predicted that the longer the COVID virus, like any other virus, is out in the world, it will aim to try to survive. And by doing that, it changes, it morphs itself. And we were always at risk for what we're seeing today happening. I think that's what put the pressure on vaccination and trying to really squelch out the COVID virus before it twisted and turned. But ultimately, I think, clearly, if we look at national data, the infection rates are up. We see, particularly in certain states where vaccination is lower, not only are positivity and infection rates up, but hospitalizations are up and deaths are up. Our hospitals, particularly in a series of states that we all have seen in the news, Louisiana, Alabama, Arkansas, and others, Florida certainly being the hottest of hotspots, we have seen, our hospitals yet again be very, very stressed. Now, I'll say, as we look at these comparators here in Massachusetts, where our vaccination rates are quite high, our hospitalization rates are quite low. And so we're tracking this. This is not like the surge we saw in March of last year. It's not like the surge we saw in December. Whereas in places like Florida, it is worse than the surge they saw in March and worse than the surge that they saw in the winter. So this is what we're seeing. This is why we're back here. And I do think it's important for us to consider how these sets of issues in this current context, which really is kind of operating at different places at different paces for the reasons that I've mentioned, what we need to think about as it relates to communities of color.
Okay. No, that's helpful, and it sounds like some of the patterns are changing with Delta, and it's drawn the attention of the country here. I guess I'm curious, and you've talked a little bit about some of the results, but what do we know specifically about the Delta variant?
Yeah, great question. I mean, so, we have seen a variety of different variants. So what's a variant? A variant, quite simply, is, the virus is changing its external structures and internal structures so as to elude immunity, so as to stay alive. And we have seen variants before emerge. And the good news is that these variants haven't been such a big departure from the original COVID virus that we were operating against, kind of the prototype, if you will. So now we've seen the Delta emerge. The Delta virus has certain particular characteristics that make it more troublesome. Again, that this is probably not news to anyone here on the Zoom, but ultimately we understand that it is more contagious at a 5 to 10x. So its ability to spread and the amount of virus that it takes to activate an infection in someone else is much, much less. And second, I'd say it's much more virulent. By that I mean it does cause more serious infections. I'd say third, and this is hopefully something that will become a leverage point for us as we engage in these kind of cross-cultural negotiations with our patients, is that it does impact younger individuals at greater rates. So, I think the conversation we were having a year ago or more was that, well, the good news is that it's not affecting kids. And that was always kind of this insurance factor that we all felt good about, right? We weren't putting our kids at risk. And ultimately, what we do understand here is that the new Delta variant does put everyone at risk. And particularly, as we'll get into, very different paths for those who are vaccinated and unvaccinated. So, I'm afraid to say that if we don't continue to make progress, there's already talk of a Lambda and others, it will not be unexpected for us to continue to face these variants going forward if we don't pivot quickly and prevent them from circulating in society. And that will be a challenge, particularly globally, as we know that whereas we have vaccination challenges here in the US, the global vaccination rates are really quite abysmal due to resources and the like. And I think that's going to be really important, because if we've learned nothing, it's that we are all neighbors on this planet. And fundamentally, something that happens clearly all the way across the globe eventually will make it here. And so we also need to be invested in kind of global vaccination as well, and what we're doing in that space.
Okay, that's helpful. That's good to know. And I guess, and you kind of touched on this a little bit, but could you talk to us a bit more about what is the impact of Delta on vaccinated and unvaccinated people?
Certainly, it's a question that we have all been struggling with, that we have been learning more about. And, quite frankly, what I share with you here today might change, but what we do know, and again, it's kind of interesting here in Massachusetts, we've been again ground zero for this in some way, in that, the pandemic back in March was tied to a conference here in Boston, and now we've had this large Provincetown outbreak out in Cape Cod, which has been incredibly helpful, actually, and illustrative, as we've been able to do a lot of quick analysis, as has the CDC, about the Delta variant, how it spreads and the like. So this is what we know to date. What we know is that the vaccines, and certainly Moderna and Pfizer, and I think our going thought was that Johnson & Johnson as well, and new data is just emerging to support this, are all very effective among those who are vaccinated at preventing severe illness that includes hospitalization and death. That is great news. It is the ultimate insurance policy for your life if you get vaccinated. So the Delta variant shouldn't pose a risk to you. That being said, we do see that we are identifying breakthrough cases. This means that a person like me, who is fully vaccinated, can go into a supermarket without a mask, pass somebody in an aisle who coughs or sneezes or is talking loudly, and just with the tiny aerosolized virus, I can then be exposed to the Delta variant. And one of a couple of things might happen. One is I may have no symptoms at all, and my immunity may protect me from developing enough of a viral load to spread it to others. And so I feel nothing. But the spectrum might be all the way to I may get flu-like symptoms and be able to have a high enough viral load to spread it to others. So the caution here is that even among the vaccinated, while we are assured, and the data is playing out clearly, that hospitalization and certainly death are exceedingly rare if you're vaccinated from the Delta variant, there's absolutely a possibility that you could, number one, test positive, and within that spectrum be asymptomatic or symptomatic, and within that spectrum spread it to others. So that's the reality for us, and so we'll talk more about how we address that. Now you have the unvaccinated. The unvaccinated are at an incredibly high risk of, again, a virus that is easier, spread more easily, more contagious, and a nastier virus, and a virus that impacts kids. We also understand that kids under 12 are not vaccinated because that hasn't been approved yet. We'll be driving there hopefully in the fall, and I just got a new report saying that maybe in the fall we'll go to 5 to 11, and then shortly after that go to the smaller ages, 6 months and above. That being said, these individuals are at risk. They're at risk of, yes, ending up hospitalized, and yes, in the worst case, ending up dead. And the challenge with COVID, is that this is Russian roulette. I've had 90-some-year-old patients who've gotten COVID in the first surge who did fine, and I've had 40-year-old patients who've been intubated and near death for 70 days, and this virus is worse. So that's what we know as it relates to Delta and vaccinated and unvaccinated.
Interesting. Now, this is going to pose a unique problem or a set of factors as we return to the school year. So as universal pre-K programs, as schools are reopening, as students are potentially returning to classrooms, how are we going to navigate that? Because children are affected by the Delta variant and represent an unvaccinated population. So, given this, what would you recommend? Do you have recommendations here?
Yeah, I do. I mean, I'd say a couple of things. And related to your last point, this is an evolving story. I mean, right now we're planning, across the country to go back to school. There's been some debate, and as always with this pandemic, and very unfortunately, this has been highly politicized, even, prohibiting kids to use masks and those types of things. So, the net here is that, particularly, I think for parents who are very anxious about their kids going back to school, who know their kids are unvaccinated, there is real worry. So we will need to stay tuned here. There may be some pivots. As it stands now, the recommendations are to, for kids to go back to school live. And I think places that use common sense will ask that we take the small sacrifice of putting, masks on. Now, your question about what would I recommend? It's very simple. If you are unvaccinated, the simplest and easiest way to save your life is to get vaccinated. If you are vaccinated, the simple and easiest way to protect your kids, protect others, and to avoid getting sick for 5 days, which nobody even wants the flu, and putting other people, immunocompromised people at risk, the simple common sense solution is you throw on a mask. People need to understand that the risk benefit here is mask versus ventilator, right, or death, right? That's the calculation here. And so we need to, be thoughtful just about the level of sacrifice we're asking people to make with a mask. And so what am I doing? I am vaccinated. In indoor spaces, I'm wearing a mask. So when I'm going to the supermarket, I'm wearing a mask. I'm trying to limit indoor restaurants, to be honest. I mean, I think the weather's good most of the country, so benefiting from the outdoors is a great thing. Although, with the appropriate spacing and windows open and the ventilation, certainly, this is all about risk mitigation. And that's something you should consider. But I think it's common sense. No, I mean, yes, I could say, well, I have the vaccine, so I'm going to go to the supermarket and not wear a mask. I don't want to be sick at all. I don't want to spread this. And so that's the basic, I think, recommendations that we are making. And a lot of this, even across the entire pandemic, has been common sense. And so just thinking about that with the information we have, and understanding that information changes, not because it's political in nature, not because anybody's trying to control anybody, because science changes. The more we learn, the more we need to pivot. And so I think that's where we are as it relates to vaccination and mask wearing. Those are the recommendations that I would share, with all of you who are on, and I would ask that you share with anyone who might listen.
Okay, so essentially, yes, returning to some of that caution and vigilance that we had in the previous year. Okay. Understanding kind of where we are, some of the differences of the Delta variant, some of the issues that we faced, recommendations here. Could you talk a little bit more about what this means specifically for our minority populations?
Yeah, so that's been the group that we've been fighting for from the start, and I think really focused on. So I'd say, there's several observations that I have, and I think a lot of these are coming, quite frankly, from some of the discussions I'm having with my patients. But to take a step back, we clearly are seeing kind of two populations who are resistant to vaccination. One is a group of individuals who, for whom the political narrative has made them, strictly against the vaccine. And there's another group whereby the same issues that we've been talking about forever, mistrust, misinformation, just concerns, continue to be a driver in that lack of confidence and hesitancy. I would put minority populations more squarely in that latter group, more still in the group that is just hesitant, wants to still wait a bit, is concerned. So that's what we're seeing. Now, I think that group that I feel is more movable with effective cross-cultural communication, with effective building of trust, that to me is a movable group. The other group, I think, we're going to need to fight our way through that. But the group that I think needs information in a culturally and linguistically competent way, that needs us to be able to negotiate with them, to talk about now, this is not just about your health, this is about your kids' health. This is, I think, where our pivot is. So when I think about, our vulnerable communities, we still do see in certain vulnerable communities higher rates of those individuals who are unvaccinated. So our primary goal needs to be engaged in this effort in these vulnerable communities to continue to encourage vaccination. Now, the types of questions I'm getting in my practice are, well, I want to wait a little. I'm going to run through a couple and how I respond to them among my minority patients. Well, I want to wait a little bit longer. This is a very different conversation than it was in March. I could say, we have hundreds of millions of people who've been vaccinated. You are not first, you are not 10th, you are not 1 millionth. We have a lot of great data. And what we've seen is that people have very few side effects. We have a strong sense of long-term side effects not being an issue now. That usually happen the first 30 days. We're months out. And so I can really provide them reassurance around the safety of the vaccine and them not being first. The second I'm hearing certainly is, well, this, the vaccine was created fast. I again reiterate that this is technology that was in the wings for a long time. We've been able to deploy it. That's an advantage. Like other technologies, like my cell phone, how fast that's changed over time. I try to create some analogies just to demonstrate that speed can often mean better. It doesn't have to mean worse. And more often than not, if done well, speed means better, and that's what innovation is. So, we have those conversations. I think another key area that I'm trying to leverage is I take care of a lot of people who do a lot of things to maintain their health. Two things: they've gotten vaccinations their whole lives, one, and number two, they've gotten their colonoscopies, they've gotten their stress tests. And so what I try to say to them in this instance is, you have done everything to take care of your life for you and for your family. You have gotten vaccinated before. Let's not make this vaccination mystical. It is not unlike others. And I would argue in today's day and age, it is more important than any vaccine I could ever give you. So, the opportunity to leverage your desire to take care of yourself and what you do, and the fact that you've gotten vaccinated before, that gives us an opportunity. And then finally, I'm really leveraging, this desire to protect your family and kids in particular. I'm having very real conversations about, we sacrifice a lot for our kids. We do a lot of things for our kids. This is the ultimate sacrifice for your kids. Getting the vaccine is the way you can protect your kids. And so I think, Noah, for me, minority populations are a movable target for us as it relates to vaccination. I think those are some of the kind of cross-cultural issues that we've been talking about for a while, building trust, addressing those concerns. Still hearing a lot of concerns around fertility, if you can imagine, still hearing that. So talking about, we have a lot pregnant women, lactating women, people have been able to get pregnant. Kind of, the benefit we have now is a lot of data that we didn't have in March. And so our ability to advance that conversation is very, very important, and is what we're leveraging now.
Okay. So being able to leverage some of the experience we have, reminding that it's part of a sacrifice that we make. It's kind of paying into a greater community good.
Sure.
And it sounds like, focusing specifically, these are responses that focus on communities that are hesitant rather than explicitly opposed to the idea of vaccination, which is probably a much different and a much longer discussion. It's funny that you mentioned this. we have some questions that were submitted by audience members.
Great.
A few of them were related to fertility, so I'll try to get to those. But first, if it's all right, I'll start with one that is, how can health plans address emerging disparities in vulnerable communities?
Yeah, look, I think what we've learned, and we've worked with health plans, in my career, I've worked with health plans, hospitals, health centers, all healthcare stakeholders on topics related to disparities. And I think this topic is no different. We need to have an all hands on deck. And if nothing else, really explore the areas where we could find economies of scale and efficiencies here, working with partners. And I think if I'm, in the health plan space, clearly, I think continuing to message the importance of the vaccination in culturally linguistically appropriate ways and supporting that. Continuing, or I would say in a new way, leveraging the new information we have about the danger of the Delta variant and all the other things I mentioned, critically important. We have to keep our foot on the gas here. And I think health plans, this is a critical opportunity for them to leverage the capacities they have, data, communications, partnerships, to not only address COVID, but we've learned a lot about COVID that will absolutely be helpful in addressing disparities at a go-forward basis. And what we've learned is data is king. Performance measurement, like we've always talked about, hotspotting is critical. And then thinking about not reinventing the wheel, but these culturally competent approaches to addressing whether it be diabetes screening, hypertension control, colon cancer screening, whatever it may be. I think what we're learning from COVID is that there are a set of critical success factors that health plans can deploy in partnership with others that could help us be more effective with the disparities we're seeing right now with COVID, but certainly some of the other disparities we've been trying to tackle for decades.
So being able to take the lessons from COVID and apply them to other pressing issues. All right, and that's a good segue into another question received from a community health plan. How do you identify the champions and trusted messengers in the community you've determined will benefit most from an investment of resources and energy?
That's a great question. I mean, I think this is why building community engagement mechanisms that are there for the long haul and aren't just drop in, drop out are really, really important. And I would say, we have tended to go to the community partners that we've had in the past, things like faith-based organizations, in certain communities, barbershops, bodegas, things like that, right? And I do believe that those are still very, very effective partners. Certainly, I think there are a lot of individuals out there who have been trusted messengers and have been kind of beating this drum for a long time, both in specific communities, but others that you could leverage even outside the community and kind of leverage inside the community. So, the power of what we're able to do virtually does give us a chance to pipe in someone from another place to kind of engage a community while we leverage some of those community experts. I think the way you identify them is really by having these conversations, reaching out to some of the usual suspects and assessing, how bought in they are and how eager they are for partnership. A lot of them know they need resources and they need to be connected to somebody who can give them some, kind of informed discussions like this and can answer these questions. So, if I'm a hospital, I'm a health plan, and I want to, kind of tackle a market, tackle a catchment area, yes, I'm going to start to talk to some of the, well-recognized community-based organizations and say, hey, are you interested in a partner? How can we help you? Are there individuals we could bring? Are there individuals in your community that we could support that could help us with your vaccination rates? And certainly assuring that there's good access, because great information without access to the vaccine is not very effective. We've done a lot around access, so that's something that I think gives me, great confidence, is that compared to months ago where it was keeping me up at night that we didn't have enough vaccine in vulnerable communities, now it's how to get vulnerable communities to get the vaccine that we have there right now.
Okay, that's very helpful. And a lot of the questions that we received centered around this messaging, partnerships, and access. There's another question here. Are there examples of successful community partnerships that have resulted in either a lower incidence rate and a higher vaccination rate in communities of color? Basically, examples of success.
Yeah, a great question. I mean, I think we've had a couple, and I'll speak from personal experience. We've launched major mobile efforts on vaccination. And what we do is we have them in different hotspots, and we work with community-based leaders to identify where we should be posting up and how we're going to engage. And I think one thing we've learned, is that as we've talked to some of our community-based partners, they've been very well intentioned. What they've been missing is the data. They have general data on their town, but they don't have hotspot like by neighborhood, right? And so they might ask us to go to a certain place and we might vaccinate 10, 12 people. We found that choosing a location has been really, really critical. And we've created a set of kind of criteria or discernment factors for when we will leverage our mobile effort. And more often than not, that has been working directly with a community-based organization, going to their site. They have a captured audience, people who are loyal to them. They have leveraged other activities as part of a vaccination effort that have ranged from cotton candy to Zumba classes, really trying to draw people in and to make this celebratory. And we've seen great progress in those areas compared to just kind of posting up just anywhere. We've tried to be helpful by providing a little bit more data that's more specific within these cities and towns. But I would say that clearly we've made great progress in a couple of our hotspots by continuing to refine where we go with our mobile vaccination. So I think that's a good example of how we've had successes there and what some of the critical success factors are. Good communication, having messengers there to not just say, hey, come here if you want to get vaccinated, but come here to learn. And if you come here this van, doesn't mean we're going to vaccinate you. We're happy just to talk to you about it. That's a lesson we learned too, because when we set up the mobile vaccination, people said, oh boy, I have questions, but I'm afraid if I go there, they're going to push me to get it. Come, we'll talk, but we have it available.
Okay, identifying locations, establishing a rapport, leveraging organizations that already are present and have credibility in the communities. Right. Okay, there's one more that kind of falls into this, if we have a second here, and it's how do we work around vaccine hesitancy? Specifically, how do we get our staff to be more understanding that others are still vaccine hesitant?
Yeah, it's a challenge, and the one thing I worry about is that there is this kind of, we're going to see a narrative that worries me about our minority populations is that they are being difficult, that they are not cooperating, and that's challenging, right? Because I think there is this frustration emerging with the unvaccinated. And I like to reiterate that the unvaccinated are, again, in these two camps, and our response to those two camps should probably be a little bit different. One is amenable to more information, and I think so we're trying to articulate some of the difference there, just so to give people a greater sense of empathy and understanding. And I think we're trying to leverage, again, the types of things we've always been doing, which is making sure that we increase awareness around where to get it, that we facilitate getting it through scheduling, transportation, mobile, make that ease, and that we address hesitancy through our trusted messengers. And we're doing that with our employees. And the truth of the matter is, around the country, we are seeing more, particularly hospitals and healthcare systems, moving to mandatory. And they're waiting for the EUA to move to full approval. But with the Delta, that's really putting pressure on. And the hope is that the FDA is going to move in the next few weeks to just doing full approval. So we're moving there. We're moving towards that requirement, and that's going to be something that I think we're hoping people will fall in line and be part of this effort. But I would say it's the same mix of things. It's just keeping our foot on the gas on all of them, but really avoiding demonizing people, who just haven't had the opportunity to get good information. We need to do that, steadily. As
we bolster up pathways to tailor to culturally competent, specific messaging, to remain empathetic and vigilant. Okay, that's great. Dr. Betancourt, thank you. It's about 1 o'clock, and I know you're busy, so I don't want to push over our timeline. Thank you. It's always a pleasure. We have great registration and great interest in this topic, so thank you. And we look forward to having you here and continuing this relationship and the opportunity to share what you are seeing at the front lines with our subscribers and with our clients. So
I appreciate that, Noah, and thanks to everyone for tuning in again. And I'd like to say we won't have to keep doing this a whole lot more, but we will be here if we need to. So I'm thankful for everybody who joined. We will be here as a resource, and hopefully there's something I said in here that's helpful, that allows you to move forward in this area. we do need everybody engaged in this, and I'm thankful for everybody's commitment and dedication.
Wonderful. Thank you.
Thank you all.